The autumn leaves are already on the ground near Nikki's home in North Devon. It won't be long before winter is with us once more. Nikki is in remission from blood cancer. Her physical health is good, but 18 months of shielding has left her feeling fearful and angry.
We seem to be doing the same thing over and over and over again. We all want this to be gone. I just want to be able to say, yes, it's over. I'd be the first person to throw a party, but it isn't. You can't legislate with the virus. You can't argue with it. You can't, persuade it. Why are we proceeding to keep pushing forward?
The government yesterday said it stands ready with a plan B if cases and hospitalisations continue to rise. Nikki feels things are moving too quickly.
I think we just need to slow down. If I go into a shop and I put a mask on, it's not a big intrusion on my life. There's so much talk about having our freedoms. We have our freedom, and by not actually putting a mask on, maybe not filling your house with people, we're actually going to have that for longer, and we're going to be able to continue it for longer.
Nikki is proudly outspoken on the rights of the clinically vulnerable, but her candour has left her open to criticism, particularly on social media, some of which can be quite unpleasant.
We're not crazy, we're not overreacting. If you're diagnosed with cancer now, you almost have a double diagnosis. Okay, I've got cancer, I've got to deal with that, but actually now I'm vulnerable. And there is no framework now, there's no recognition, there's no legislation, there's no help. We've done 18 months of shielding, and I personally now am resigned to the fact that I'm going to catch this.
People who are classed as vulnerable will soon be eligible for a third booster jab.
Having that booster vaccine now gives a greater level of protection, longer lasting levels of protection, which again prevents the severity of the infection and hopefully reduces the prevalence of hospital admission.
When you walk down a high street like this one in Launceston, it feels as if things are pretty much back to normal. The shops and cafes are open, masks and social distancing are no longer a legal requirement, but COVID continues to have a big impact on the lives of people with serious illnesses, and charities say they're worried about what the winter might bring.
If cases rise, if more people are getting COVID, that's going to put more pressure on the National Health Service. It's going to mean more people are dying, more people potentially dying at home. And as I say, the government's proposals, either its Plan A or its Plan B proposal for the winter, do not include a comprehensive plan to support organisations like Marie Curie, who are delivering frontline care in support of the NHS in people's own homes.
18 months on from the start of all this, it feels as if we're only just scratching the surface of how COVID will change all of our lives. Sam Blackledge, ITV News.